Hey guys, welcome to part 3 of our endocrine system lecture. So for this one, we're going to be starting with parathyroid gland. So we describe the function of the thyroid gland and one of its main hormone being calcitonin in terms of controlling and elevated levels of calcium in your bloodstream. The job of parathyroid gland would lie on the opposite of the thyroid gland and the calcitonin, and that is to increase the level of calcium in our bloodstream when the levels are low. So in terms of location of the parathyroid hormone, which is one of the first things I want to talk about, is that they're located on the posterior surface of the thyroid gland. Which basically means if you take a look at this picture, here is the back part of the lobes of the thyroid gland, and you can see these little tiny spots in orange, and those are your parathyroid. Parathyroid numbers do change based on individuals, and their location also varies from person to person. Now, the main type of cells that we have inside the parathyroid cells are called chief cells. And their job is to, again, produce and release a hormone called parathyroid hormone. Parathyroid hormone, again, happens and gets released when there is a decrease or low levels of calcium in your bloodstream. So keep in mind, again, we're kind of following that same path of homeostatic feedback, where you start with the stimulus and you end with your results. So here is our path. The level of calcium in terms of set point is between 8.5 milligram per deciliter. And the highest aspect of that would be 11 milligram per deciliter. So in this case, we have a scenario where your stimulation happens because your calcium level is below 8.5 milligram per deciliter. So parathyroid gland in this case is going to act both as your stimulus, not your stimulus, as your sensor as well as your integrator. So parathyroid is again both your sensor as well as your integrator. That causes the production of your output, which is your parathyroid hormone, or simply PTH. Now, the targets for PTH is the same as your calcitonin. Would be your bone, your small intestine, and your kidneys. But the roles are kind of reversed in this case. For instance, if you're taking a look at your effector kidney, now your kidney is going to keep or reabsorb the calcium back into the system and limit the excretion of calcium from our system. So you bring in more calcium back into your bloodstream. Kidneys also release another hormone called calcitriol. Now, calcitriol doesn't affect the kidney itself, but it targets targets your small intestine. So a small intestine is being affected both by PTH as well as calcitriol at the same time. So it needs both of those inputs. And when they are present, then you will see an increase in absorption of the calcium in our system. So more calcium, again, comes in from what you have eaten. Last category that's being affected is your bones. And in this case, remember that your bones is literally a deposit of calcium. So osteoclasts, which are cells that are responsible for bone breakdown, under the influence of PTH, break down the bone or dissolve the bone and release the calcium into your bloodstream. Consequently, all of these causes an increase in the level of the calcium, which is your response, and back to normal or elevation above 8.5. And that is basically our goal. And again, this is a negative feedback loop, guys, which means when I am back to my normal level, then I don't need this hormone to continuously secreting, and therefore this system will shut down through the negative feedback loop. Pancreas is the next organ we're going to talk about. Pancreas is one of the organs that is part both your digestive system as well as your endocrine system. In terms of digestive system, it releases pancreatic juices or digestive enzyme that helps with very much with the digestion of food in the small intestine. The endocrine function is release of two main hormones called insulin and glucagon. The insulin and glucagon are produced and released by the two categories of cells called alpha cells and beta cells. Alpha cells that are basically going to be your cells that are going to be releasing your glucagon. They are active and secreting glucagon when there is a decrease in blood glucose. And beta cells, which are usually the focus when we're talking about diabetes, beta cells are going to be secreting insulin when there is an increase in the blood glucose level. And that typically, again, happens right after you consume food. So in that term, let's take a look at what is exactly happening when there is an elevated levels of blood glucose. So again, right after you eat. So anything below 120 is considered to be normal levels of blood glucose. However, if that level increases above, you're activating your homeostatic feedback loop. So increase in blood glucose above 120 milligram per deciliter will be identified as your stimulus. Pancreatic beta cells are going to, again, like what we've seen for calcitonin as well as your PTH, are going to be both your sensor, which is basically part that notices there is an increase in glucose, as well as your integrators, which is basically going to release your output. In this case, your output is your insulin. So insulin is going to go and target your following effectors: your cells, typical cells, your liver, as well as your skeletal muscle. What is the response of these effectors when there is the insulin present? So your liver, skeletal muscles, and your cells are going to take up glucose that is in your blood and convert that glucose to glycogen. If you do not remember the relationship between glucose and glycogen, a reminder, glucose are single individual sugar molecules. Glycogen is when you have hundreds of glucose molecules forming one structure, which is your glycogen. So glycogen is a way for our body to store glucose. It's a complex carbohydrate that actually literally made up of hundreds of glucose molecules. Now, why is that important? When that glucose gets converted to glycogen, the level of glucose in your bloodstream drops below the acceptable range, or below 120, which means you are back to normal range. Please, again, do keep in mind that this system is maintained through negative feedback loop, which means when your level is back to normal, the level of insulin in your bloodstreams lowers and shuts down this pathway. Now, I did not include what happens when the blood glucose level is below 90 milligram per deciliter, which means basically you're dealing with low blood glucose. I will go over it right here by just going over this picture, but you are expected to know it. So when there is a decrease in blood glucose, typically below 90 milligram per deciliter, pancreatic alpha cells are going to release glucagon, not insulin, glucagon. It's going to target cells, liver, and skeletal muscle. And it's going to cause liver only to convert glucagon or convert glycogen to glucose. So basically, you're going to use the storage of sugar that you have, and you want to convert it back to glucose, and that glucose can get released into your bloodstream and return the blood glucose level back to normal. So your blood glucose increases above 90 milligram per deciliter. Please do note that I didn't include a skeletal muscle glucose here. A skeletal muscle is identified as selfish, which basically means when it takes that glucagon in, it's not going to allow that glucagon to come out as glucose. It wants to use it only for itself. So when we're talking about glucagon, it wants to use that glycogen for itself. So when we're talking about the path for glucagon hormone, everything is identical to what we're talking about insulin, just reverse it, minus the skeletal muscle. The skeletal muscles will not allow that glucose to come out and introduce back into the bloodstream. Now, we have talked about one type of diabetes which was related to the levels of ADH, but the more common type of diabetes we have described is diabetes mellitus, which is as a result of changes in insulin. Either your body is becoming resistant to insulin, which is type 2 diabetes, or your body is unable to produce insulin because the beta cells have been destroyed through an autoimmune response. So type 1 diabetes, just put it in perspective, also known as juvenile diabetes, is usually developed in children, typically before the age of 15. It is an autoimmune disease, which basically means your specific category of immune cells called T cells target your beta cells and destroy them. And therefore, you lose the capacity to make insulin. These people will be insulin dependent for the rest of their life. There is basically no cure. It has nothing to do with what you eat. Type 2 diabetes, it's adult onset diabetes. This has a lot to do with having a sedentary lifestyle, a lack of exercise, eating unhealthy. Typically, it starts after the age of 40. However, we do see a lot of younger people developing type 2 diabetes as a result of unhealthy eating. In such scenarios, it's not that your body is not producing insulin, is because your body has such a high level of insulin continuously, your cells basically kind of ignore it. So your cells become insensitive to insulin. Consequently, you need to take a much higher dosage of insulin through injections in the abdominal region to get that extra insulin in and kind of force your cells to take that glucose. Type 2 diabetes can be reversed through surgeries like gastric bypass or lap band surgery, which kind of limits the diet. Exercise can help significantly, but there are cases where type 2 diabetes are basically with the person for the rest of their life, and they will be insulin dependent. Here is basically a depiction of what I'm describing for you guys. So in this case, you basically have very little insulin. Your cells are still insulin sensitive, and they can do their job. Here you have a scenario where your cells become insulin resistant, and you need a much higher level of insulin to allow that glucose to be taken up by your liver, your muscles, and your fat cells, or your cells. Next gland we're going to talk about is your adrenal gland or supraadrenal gland. It sits right on top of your kidney. It has two major separation. The outer edges of it is called adrenal cortex, and the inner center, which is a knot of, a collection of nervous tissue, is called adrenal medulla. Now, adrenal cortex, as you can see in this picture right here, and more clearly on this picture, adrenal cortex is broken down to 3 layers. The outermost layer of adrenal cortex called zona granulosa. The second layer, which is the thickest layer, is called zona fasciculata. And the innermost lining is called zona reticularis. Now, let's take a look at what each of these layers of adrenal cortex produce. So zona fasciculata, which is the middle layer, is under the control of your adrenocorticotropic hormone, or ACTH, and produces glucocorticoids, the most common one being cortisol. So you may have heard of the cortisol in terms of injections, when people get injections where they have pain, or they sometimes call them steroids. If you have severe infections, you may get cortisol injections. It is the same thing. What is the job of glucocorticoids? Or what is the job of cortisol in our body? So these glucocorticoids are extremely important when you're dealing with some sort of a stress in your body. Again, it could be as a result of infection, a physical trauma, emotional trauma. Regardless, your body notices that there is a severe need for you to deal with something. Now, in such cases, your body starts to increase the level of cortisol in your bloodstream. Why is that important? It helps you produce glucose, so it promotes a process called gluconeogenesis, which is basically help your body produce higher levels of glucose and increases your blood glucose. And that process called hyperglycemia, that elevation of glucose called hyperglycemia. It helps you mobilize the fat and use that extra fat that you have as a source of energy. In some cases, extreme cases, it increases the catabolism or breakdown of protein and use protein as a source of energy. And it also depresses the immune response. That is a good, not immune response, I shouldn't say, inflammatory response. Inflammatory response is really important as an initial response to an infection or problem. So you do see an elevation of inflammatory response in our body when there is an infection. However, for immune system to effectively do its job, the inflammatory response needs to decline. You're also going to see again breakdown of glycogen to glucose, and that glucose being released from your liver storage into your bloodstream. Now, everything I'm describing so far is going to help your body deal with a stressful situation. And I go into more detail what happens when there is either hypo or hypersecretion of these hormones. Next hormone that we have in our line is a group of hormones produced by your zona reticularis called androgens. Androgens are the precursors to the sex hormones, testosterone, estrogen, progesterone, etc. So they eventually become a more potent type of hormones in both male and female, which we identify as sex hormones. Last category of hormones being produced by zona granulosa are mineral corticoids, main one being aldosterone. Aldosterone is extremely important in helping you maintain your water sodium balance and also removal of potassium from your system. So let's take a look at this one, the last one, in a little bit more detail on our next slide. So aldosterone happens when your blood pressure is low. There is a very complex process that is described here. I'm not going to get into that for you guys. All I want to do is just kind of introduce the vocabulary to you right now. And this is starts basically again when your blood pressure is low. You start the process by kidney producing and releasing renin, which changes angiotensin to angiotensin 1. Angiotensin 1 eventually becomes angiotensin 2. And angiotensin is going to target your adrenal gland to produce aldosterone. Now, aldosterone itself kind of goes back to the kidney. So you kind of just did this 360 for this path. Now, the goal of aldosterone is the following. It's going to help you reabsorb or reclaim sodium. And anytime you reclaim sodium, you also bring water with that. So you're bringing water back into your system, you're reabsorbing water back into your system. At the same time, when you're increasing the reabsorption or retake of sodium, you're also going to get rid of potassium. So there would be a decline in potassium reabsorption, or you get rid of that extra potassium. And meanwhile, you are reabsorbing sodium back into your system. So, what are the imbalances associated with adrenal cortex? One category is known as Addisons disease. This is when you have a hyposecretion of both glucocorticoids and mineralocorticoids. Basically, low levels of cortisol and things like aldosterone. So because of that, your body cannot properly maintain your glucose level. So glucose level drops. So you may deal with hypoglycemia, which means low blood glucose. You also may have inability to effectively reabsorb sodium and water back into your system. And therefore, you also increase the potassium level in your system. So when you get rid of the sodium, you're also pulling water out of your system and excreting it as urine. So loss of that water causes severe dehydration in many cases, and you might also have a significant increase in potassium level. Opposite to Addison's disease, you have Cushing's disease. In this case, you have an elevation of both mineralocorticoids and glucocorticoids. In such cases, your blood glucose is going to be elevated significantly, which basically means that you are going to be dealing with hyperglycemia. You may actually tackle your muscles as a source of energy, so you might have a significant loss in muscle mass. The very common way of diagnosing Cushing's disease is redistribution of the fat into the abdominal cavity, the back of the neck, which creates something called a buffalo hump. Because you have such a high level of aldosterone in your system, your body is going to retain or be absorbed high levels of sodium and water. And consequently, you're going to be dealing with conditions like hypertension, which is high blood pressure, and edema, which is where your water being retained inside your tissues. And the really, really negative aspect of it comes from the lack of inflammatory response. So you're enhancing anti-inflammatory responses. Basically, you're limiting the body to fight off infection, and that can cause lowering of the immunity. I have included some pictures in both children's and adults and what the symptoms of Cushing disease would look like on a person. But please do keep in mind that what I would like you guys to know specifically why each of these symptoms are being observed in an individual, either again, hypotension or hypertension, hyperglycemia or hypoglycemia, lowering of the immune response, loss of muscle mass, why this happens, why is exactly these things taking place, what causes each of these changes listed. Adrenal medulla, I'm not really going to go into detail about it. All I want you guys to know, it's basically a collection of nervous tissue, and they produce epinephrine, which we know better known as adrenaline, and norepinephrine, which is noradrenaline. They're extremely important if you are dealing with what we identify as a fight or flight response, basically a sympathetic response. You want to kind of deal with a very quick response, immediate response. Typically, it causes the stimulation of glucose and glycogen that is stored inside your liver. It can also tap into your lipid storage. When you have an elevation of epinephrine or norepinephrine, typically you're dealing with high increase in your heart rate, increase in your blood pressure, blood vessels constrict, which we call vasoconstriction, to help you increase your blood pressure. And for long terms, having these at a high level can also cause severe consequences. Gonads in our body, depending on male and female, we're talking about testes and ovaries. Testes, main hormone produced by them is testosterone. As I mentioned earlier, some of the main changes you will see in case of elevated testosterone levels are secondary sex characteristics like deeper voice, increased muscle mass, facial hairs. It also helps promote the development of the sperm, as well as the reproductive organs, and it is under the control of the luteinizing hormone. On the other hand, we have the two main female sex hormones, which is the estrogen and progesterone. Estrogen releases when there is an elevated levels of follicle stimulating hormone, extremely important for the follicle and oocyte to mature. It also helps women developing their secondary sex characteristics like lower voice, finer hair, development of mammary tissue. Progesterone, on the other hand, gets released when there is an elevated luteinizing hormone. It helps establish the menstrual cycle in women and prepare the uterus for pregnancy. Progesterone also produced by the structure called corpus luteum. I'm not going to get into that now, but we'll get into it later on when we talk about reproductive system. Last thing that I want to literally briefly go over is pineal gland, which is located in the brain, producing melatonin, and it helps you control the sleep and wake cycle by targeting your hypothalamus. And again, that's all I want you guys to know. And thymus, which sits superior to your heart, is producing thymosins, which is extremely important for maturation of our T cells. And this is part of the lymphatic system. Kind of looking at the levels of the pineal gland hormone melatonin. Again, notice that during the day, basically you have stressors, the stressors are high, the melatonin level is low. But at nighttime, your melatonin spikes because you typically, again, you're not really dealing with any stress and your glucocorticoid level goes down. So that is it for our endocrine system lecture. If you guys do have any questions, please visit me during office hours and we can go over anything that may have confused you. Thank you, guys.